Patellar tendinopathy, Achilles tendinopathy, rotator cuff tendinopathy. Do you have difficulty in keeping these patients out of pain? We all do. And the reason is shared. It's shared between you and also the patient. Because when there's any injury to a tendon, the way it heals is not as strong and a touch more painful than it was preceding that injury. Some of the things we can actually help with. We can teach the patient about healing. We can teach the patient how to load that tissue. But if we don't do all the things necessary to heal a tendon, unfortunately that patient is left with that weaker, more painful tendon. So today's blog is about that because it excites me that there are things that we can do that other healthcare providers don't do. We provide that multimodal care. Now with ChiroUp, we're going to talk about manipulation with manual therapy, with myofascial release, with tools like instrument-assisted manipulation to help get people out of pain. But what's often left in the back burner are those things that are so important to these patients. We have to be able to first recognize this is tendinopathy and nothing else. Fortunately for this diagnosis, you push on it, you make it work, and it hurts. It's usually a focal pain. In the case of this blog, like patellar tendinopathy, we can do a couple simple tests, like the eccentric decline test, to actually load that tissue a little bit more than you or I could do in an orthopedic examination and reproduce that patient's symptoms. And the most important part is we have to take a multimodal approach to treating these patients. The multimodal approach is not just the things that we can do for our patients, it's to dig into that person's life. It's to find the habits, the hobbies, the sports, whatever it may be that's causing the overload of that tissue. Now, the one thing that I don't talk about in this blog that I'll talk about in the video is sometimes it's not an activity. Sometimes it's a postural load, a static load that can also cause these tendinopathies or at least prevent them from healing. So think about that, whether it's just sitting in one spot, whether it's a certain position, whether they're a welder or whatever it may be, look at those positions and postures and make the appropriate changes. Because if you can do that, not only can you prevent the re-injury, but you can let them heal. Consider this also, is that pain, especially during your rehab, is not a stop sign. When it comes to tendinopathy, you need to progressively load that tissue. Progressively loading isn't always strengthening though. It can be isometric. It can be dynamic, and we'll talk about that in the blog. However, we need to start to move that tissue, and it's going to cause a little discomfort, at least in the beginning. And therein lies the conundrum. A patient comes in with pain, and you need to have the conversation with that patient and say, we're going to get you out of this pain, but at the very beginning, it might cause a little discomfort. And what we know, if we give them the right set of exercises, like the eccentric squat test and the eccentric exercises that you'll see in ChiroUp, it's going to cause some discomfort, but if it doesn't go above a 4 out of 10, if it doesn't radiate down their leg, we can see dramatic improvement in pain immediately and long lasting. The references are in the blog. The next is surgery. That a lot of times after someone is not getting better in my care, I think about who else I can send them to. In the case of tendinopathy, surgery is not a great option. So in that respect, stop looking at who else you can send them to and start to look at what is this person doing in their life that's perpetuating this problem. A lot of times it's simple stuff. It's their morning routine. It's the way they do their job and finding strategies to help these patients. We need to dig into this person's life as far as possible to help alleviate as many variables as possible to get them better. In that case, we can get this person from acute pain and prevent them from going into chronic pain. I hope this helps. Please read the blog. All the references and the examples are in the blog. However, there's a quick synopsis of what you're going to learn. And at the very end of this, use the condition report. When a patient comes in to see me and I've got 10, 15 minutes with them, I can't explain as much as I need to explain with that patient. I need to teach them everything that I know about patellar tendinopathy or any other kind of tendinopathy within that time period, along with treating them. It's impossible. Use the resources you have to help educate the patient so they can make informed decisions about their own care to help you get them better results. Thanks for watching, and check out the rest of the blog in the blog section.